Hello, thanks for watching this video. By watching this video, we'll help you understand what contextual factors are based on the work of the OMERACT Contextual Factors Working Group. In our first video, you learned about our working group and our progress to date. As you may remember, OMERACT defined a contextual factor as a variable that is not an outcome of the study, but needs to be recognized and measured to understand the study results. This definition has been criticized for being too broad and confusing. We wanted to elaborate on the current OMERACT definition to make it more understandable. We interviewed patients, clinicians, and researchers about what they understood by contextual factors. Based on the results, we developed an elaborate description of contextual factors, and we invited people within the whole OMERACT community to provide their opinion and feedback in a Delphi survey so we could revise the description. In our studies, we found 3 different types of contextual factors which are relevant within OMERACT. We have named these Effect-Modifying Contextual Factors, Outcome-Influencing Contextual Factors, and Measurement Affecting Contextual Factors. These types describe different ways that contextual factors can influence the results of a clinical trial. Let's go through each of them, starting with an example. In a clinical trial, patients with rheumatoid arthritis were randomized to receive a drug or to receive placebo. From the results, it's clear that more patients are responding in the group receiving the drug. But maybe the chance of responding depends on certain characteristics of the patient. Let's try to divide the patients according to disease duration and see how the results look. Now you can see that the subgroup of patients with longer disease duration have more benefit of the drug because the difference between the drug and placebo is much larger for this subgroup. The patients with shorter disease duration, however, does not seem to have much benefit. In this example, the treatment effect depends on the patient's disease duration. So disease duration is therefore an effect-modifying contextual factor. This finding needs to be tested in more studies, but in general, effect-modifying contextual factors can reveal for whom a treatment is effective, which is important knowledge for clinical practice. If doctors tailor the treatments to the individual patients based on their characteristics, it's called personalized medicine. In more technical terms, effect-modifying contextual factors are so-called modifiers of the treatment effect in a clinical trial, like we saw in the example. And they are measured at the beginning of a trial. Effect-modifying contextual factors need to be relevant for personalized medicine. And finally, they need to fit within the classification categories personal, environmental, or disease-related factors, and they need to be measurable. This could include factors such as age, sex, race, disease duration, and so on. Let's now take a look at outcome-influencing contextual factors. In a study, patients with knee osteoarthritis was followed over time. It was found that high body mass index, older age, and high comorbidity count are associated with future disability. These factors are said to be prognostic for disability and can be considered outcome-influencing contextual factors. The natural progression of a disease in patient subgroups is relevant knowledge for clinical practice, but also for researchers conducting trials. A group of researchers wanted to investigate whether there is a relationship between physical activity and future disability in patients with knee osteoarthritis. They grouped the patients according to daily physical activity, and they found that physical activity was associated with lower risk of experiencing future disability. However, since this study is not a randomized study, the 4 groups will likely differ with respect to important outcome-influencing contextual factors that may confuse the results. For example, maybe the most active group mainly consists of young patients with low BMI and few comorbidities, which naturally would reduce the risk of future disability. Therefore, the results need to be adjusted for such factors. And when the researchers did that, it turned out that the relationship is actually less pronounced. so the original results were confounded. As shown in the example, outcome influencing contextual factors are prognostic, which means that they predict the outcome or natural course of a patient's condition, often called the prognosis. They may confound the results of non-randomized trials if they are not equally distributed between the trial groups. And finally, outcome influencing contextual factors need to fit within the 3 classification categories and need to be measurable. The last type of contextual factors is the measurement affecting contextual factors. We will start with an example. A group of researchers wanted to study how good 2 measurement instruments for joint pain are: the visual analog scale and a numeric rating scale. They choose to study the reliability of the 2 instruments. If the instruments are very reliable, they will produce the same results when repeated in a situation where the patient's pain is not expected to change. If the instruments will produce different results when being repeated, then the measurements would not be precise. The researchers asked patients with rheumatoid arthritis to rate their pain with each instrument 2 times. They found high reliability of both instruments. However, when divided the patients according to literacy, they found that the VAS instrument is less reliable in illiterate patients. In this example, literacy affects the reliability of the VAS instrument but not of the NRS instrument. Literacy is therefore a measurement affecting contextual factor for the VAS instrument. Measurement affecting contextual factors can reveal whether the measurement properties, such as reliability, are stable across different patients and environments, and OMERACT can help ensuring that robust instruments are being used in trials. A key criterion for measurement affecting contextual factors is that they impact the properties of a measurement instrument, such as the reliability, validity, or responsiveness. Measurement affecting contextual factors are specific to the measurement instrument and are ideally measured at the same time as the outcome. Finally, they need to fit within the 3 classification categories and need to be measurable. We have now been through the 3 types of contextual factors. As a short resume, effect-modifying contextual factors are modifiers of the treatment effect in a trial and are relevant for personalized medicine. Outcome-influencing contextual factors predicts the natural course of a disease, the prognosis, and they may confound results of non-randomized trials. Finally, measurement-affecting contextual factors are factors that impact the measurement properties. Common for all the contextual factor types is that the specific factors within each type needs to be either personal, disease-related, or environmental factors. It is important to understand that the types of contextual factors are describing ways that trial results can be influenced, and therefore, some specific factors such as sex may both be effect-modifying, outcome-influencing, and measurement-affecting contextual factor. Thanks for watching.